Hey, my name is Ksenia Mamantoa, and today I'll introduce the topic of celiac disease. I'll cover what this disease is, its psychological and physical effects, and its impact on both parents and those around them. Let's start with what the celiac disease is, and it's an autoimmune disorder triggered by gluten, damaging the small intestine, and it's primarily genetic. Gluten is found in food like pasta, bread, and beer. You may know people who avoid gluten, highlighting that the celiac disease is one of the most common lifelong disorders, affecting 0.7% to 2.9% of the population, and it's more commonly women and close relatives of the patients. People with the celiac disease often have symptoms like bloating, constipation, gas, lactose intolerance, and more that you can see on the screen. But to recognize that you have a gluten intolerance, there are other warning signs such as digestive problems, chronic fatigue that interferes with daily life, skin problems, nutrient deficiencies, and mood disorders such as depression. It is also important to know that there are currently two types of the celiac disease: classical with stomach related symptoms and non classical with symptoms like anemia and migraines. Having discussed the symptoms and defined the types of the disease, we can move on to diagnosis types of celiac disease. We have blood tests, biopsies of the small intestine and skin, and genetic testing. But the main and more commonly used test is the TTG-IGA, tissue transglutaminase antibody blood test, which is accurate at detecting most people with a celiac disease on a gluten-containing diet. It checks antibodies or immunoglobulins, which are proteins produced by the immune system. A high number of antibodies in blood indicate celiac disease. If you get a positive result of this test, then the only treatment you can get in this case is a proper further diet to exclude food that contain gluten. But since it's a genetic disease, there's no prevention, unfortunately. Thus, patients need to adapt their lives to new eating habits, but it's not easily because they exhibit lactose intolerance, which also excludes products of the dairy origin from their diet, and also lead to vitamin and mineral deficiencies, osteoporosis, and iron deficiency anemia. Moreover, once diagnosed, there may be difficulty adjusting to a new diagnosis of chronic illnesses and adherence to a gluten-free diet. In patients with a celiac disease, a 10 to 22% increased risk of neurological disorders is reported. This leads to psychological difficulties, finding little or no pleasure in life, feeling worthless or extremely guilty, experiencing severe anxiety, panic, or fear, having mood swings, feeling easily irritated or angry, and also experiencing racing thoughts or agitation. And the most common is the stress. But we should not forget that this disease also affects family and friends. Uh, Celiac disease can be a significant stressor because family members now have to carefully prepare every meal, which requires extra care. Um, Also, family and friends may feel helpless or depressed. Shared activities can require much more thought and sometimes involuntarily isolate the person. It's frustrating for loved ones and can affect their relationships much. But to avoid these consequences, there are coping strategies. We have education about the celiac disease, identifying credible support and advocacy groups, psychological therapy, educating relatives, including asking for their support and for them to be tested as well, and self-efficacy. This disease also depends on personal factors. Good qualities include conscientiousness, which leads to better adherence to the diet. We have resilience, helps to better adapt to dietary changes. We have openness to experience, which helps to try new gluten-free products. And negative factors includes impulsivity, which leads to poor adherence to the diet, neuroticism, which can increase stress and make it difficult to control the disease. Also, there are psychological factors that are also influence CD, self-efficacy, which means confidence in keeping the diet. Stress and anxiety create dietary problems. Social support increases adherence. Emotional resilience help manage dietary restrictions. And finally, expanding awareness. It's really crucial. There are two components of spreading information. We have public education, where organizations like the Celiac Disease Foundation and Beyond Celiac, which run awareness campaigns and educational programs as well, and also resources of support, the most important of which are considered to be online tools containing gluten-free food databases, meal planning apps, support groups, both in person and online communities for emotional and practical support. We have medical resources such as educational materials for patients and healthcare professionals too. A lot of news and research can also be found through online resources to further develop public awareness. Here, for example, is the news about new wheat discovery could reduce the impact of the celiac disease. A research team from the University of California, Davis, led by Dr. George Dubkovsky and Dr. Wen-Yun Zheng, has found a way to modify wheat to make it safer for people with celiac disease. By deleting specific parts of wheat's DNA, they reduce harmful proteins called epitopes that triggered celiac disease without compromising the quality of the wheat used in bread making. This modification made the dough stronger and didn't affect wheat yield or protein content. These researchers believe that this approach could lower the number of people who develop celiac disease by reducing exposure to harmful proteins. The Celiac Disease Foundation has supported this research actually with a grant, helping accelerate the development of the celiac safe wheat varieties for bread and pasta. Well, ending my presentation, I would like to note something that I surprised. And did you know that the celiac disease can affect every organ in the body? Even though the root cause of the CD is an immune response to gluten in the small intestine, the chronic inflammation this condition causes can affect the entire body. And I want to introduce my public service component as well. This is going to be a little interview from three people that I actually know, and I'm going to talk about celiac disease awareness and how people can cope with it. So thank you for your attention. There are also some resources that I used for this presentation, and I hope that this video opens some new doors for you for the celiac disease awareness.